Hi everyone, it's Dr. Chris here. I'm here to talk to you about ankle sprain progressions and getting athletes back to sport in a timely, safe fashion. So if we look at a general ankle sprain, and the reason why I bring this scenario is because we recently had a client that we worked through as a team and looking at how to get somebody back to whatever it is, soccer, lacrosse, whatever their preferred sport is. So I think the most important thing I want you guys to take away from this is that not necessarily like the best corrective exercises or the best plyometric exercise is when to insert them, more importantly. So I want to give you a scenario. We have a high school student with an ankle sprain, grade 1 plus. And the tricky part is that we have a timeline. The timeline for this specific athlete, I believe, was 4 weeks to return to sport for a tournament. Now, what that does is when you have somebody with a timeline at 4 weeks, it's actually easier to manage in rehab because you can set expectations based on the timeline. So if we know at 4 weeks it's return to sport, we can work backwards. And this is everything. So this is going to be 1 week, 2 weeks, 3, and 4. All right. So if we say that this is full play. Oops, sorry. So return to sport, we're going to put down here full play, unrestricted. What that means is we actually have to have room in this to be able to progress backwards. So general rule for somebody to go back to sport, it's going to take them a while to be 100%. So general guideline that works really, really well for a lot of athletes and it's safe is 90% to return to play. So percent improvement is up here. So if we say that full throttle, full return to play, unrestricted is 90%. But the challenge becomes they have to practice before they actually play. So let's assume that we want to go to modified practice here. In order for them to be safe at practice, what you can do is you can restrict zero contact. So zero contact, maybe have them wear a bib so that they know that no one is attacking them. They're just purely, passing the ball, whatever it is. So this is contact, but then you also have to say, okay, well, if they're going to go return to play, can they do long balls, short balls? What can they do within practice? So I would restrict, so no long balls, short passes. If we work backwards, if we go return to full play is at 4 weeks, what about plyometrics? In theory, they should be full capability. So if they're full at 4 weeks, that means you have to work backwards. What can they do at week 3? We know we have to go multi-directional right before we start full practice. So when can we do lateral movement? In the first 2 weeks of healing, that's going to be tricky because there's literally a lot of soft tissue healing happening. So actually on this component, you actually might have to go lateral movement at week 3 and multi-direction and compound them on the same time. So when can you go linear? So then that makes it easier. Well, you have to be able to go linear at week 2. And here in plyometrics, it's going to be too fresh to acute. Because they're a high school student and anywhere in the world of 14 to 18, their healing rates are going to be a little different. So if we work backwards from a full throttle practice, we know that they can't necessarily return to practice, but what can they do for modified training? So the big thing here you're going to have to maintain is fitness. So if we want them to be able to play at week 3 and 4, their fitness has to be modified. So we talked about potentially adding in some type of rowing, upper body strengthening, so battle ropes and upper body ergometer, a bike, anything to keep their fitness high, or swimming. So fitness is going to be high priority, early phases, and even into week 2, so that when they hit the ground running, literally their lungs and joints are ready to handle that new increased workload. So in terms of bracing, if we're going to assume that they're going to have an ASO brace or some type of stabilizing brace, we're going to assume that they're going to go ASO for participation. You can probably go ASO all waking hours. But the problem becomes they become dependent on that. So what we would do is get them stabilized, let the tissue heal, and then what you would go is you would go compression sock for the tactile stimulation, and this would be the main thing, compression garment for these two for all waking hours, and then ASO is only for play. So you stabilize early, then move them over to compression sock because they're probably still going to have a little bit of that swelling, a little bit of that puffiness right behind the ankle. In terms of modalities, use whatever you feel is your passion. If you're a rice person, you're a meat person, do you want the movement? Are you an anti-inflammatory or a pro-inflammatory? So if you are a anti-inflammatory, you're going to go, depending on what their physician says in terms of meds, let them manage that. But let's go compression, let's go ice, and then just general movement. And then when you're gauging how far to move somebody through each timeline, you have to monitor the percent improvement. So we said, to return to sport, we want 90% bare minimum. Let's assume that they get 80% here, 70% here, and somewhere in the world of 50 to 70% improvement. This is the challenge. If you don't do what's right on the first 2 weeks, there's no going back. If you flare somebody up in those first 2 weeks, there's no way they're going to hit an 80% at week 3. So it's a mathematical game. So if you were to put all your eggs in one basket, their pain is going to be the highest here. They might be an 8 out of 10 antalgic pain, still can't manage, putting a lot of weight on that. So all you're going to do is maybe just put them in a pool, maybe put them on the bike, but in order to gain fitness, they're just going to have to go all out with some type of movement. So a UBE might be the best thing. So let's assume that they have 8 out of 10 pain early on. That starts dropping to a 5 out of 10. That's a 2 out of 10. And they might have 1 out of 10 still left over, but they're willing to take that risk. And you can make sure that they're doing that safely. So pain is not always going to be the guide. You have to look at percent improvement and then how motivated they actually are. So when we look at training and fitness, make sure that fitness stays high. Same thing in week 3 and 4, but now they're going to hit practice 2 weeks after injury. Now, this is tough, and you might say, well, it's not safe, it's not ideal. It's actually, you have to make things work for the clients that you serve. So you just have to be aware that, it's not ideal, and you communicate that to the parent, or if they're over 18, they're an adult, they can make these decisions. But ultimately, it is about being honest and transparent and tell them, listen, you can re-injure this. And if they are willing to do it, all you're trying to do is set the framework so that they're safely going to do it. I think most of the time, if you have somebody who says, if you say, well, you shouldn't play, I think they're going to look for another provider. In this day and age, they're just going to Google somebody else and find it. So you might as well be that provider to help them safely do it versus saying this, you shouldn't do this at all. I think that you can give them some opportunities and just say, I want you to hit these markers. If you don't hit these markers, you're not safe. Then it puts the ball in their court. Now you've given them an opportunity to prove it. And that's what a lot of athletes will appreciate down the line. So just make sure that if they're high pain early, do not mess up the first 2 weeks. Make sure that you are working on any form of modalities that you believe in. Make sure that you are bracing, stabilize them, an ASO brace, whatever it is that you want. Increase their fitness over the next 2 weeks. ADLs. Make sure they stay off their feet. So if they have stairs in their home, whatever it is, use step 2 and just making sure they're not doing reciprocal gait going down the steps. Allow them to have a little bit of that cheating, because that swelling, if you try and force that, that's going to change this percent improvement or pain down this way. So if they have a 5 out of 10 at week 3, it's going to be really tough at week 4 to send them in. So it has to go just perfectly. So you're not doing plyos that first week. You're going to go some linear work. Second week, third week, you're doing lateral multi-directional, going into full plyometrics. The challenge is here, it's funny, is we talk about rehab specialists and all these other things. We actually haven't even talked about rehab, because if you set the stage and you allow things to heal properly, this is the easy part. It's the all external variables setting the stage so that ankle's ready to handle everything. So actually the exercises are pretty straightforward. You choose whatever you want. You're the chef, you're the cook in the kitchen. You want to put a little salt, a little pepper here and there. You can throw in whatever fantastic new exercise that you've come up with or you've seen on Instagram, hip strengthening, core strengthening, ankle strengthening. Ultimately, you need to be able to manage the pain, and that when they are ready to apply linear force, they need to be strong and be able to manage that. So you're probably not going to be doing a lot of weight bearing exercises, do range of motion, your hip strengthening, core strengthening. So when that ankle's ready, they are prepped. There's no question about it. You might actually start doing a lot more weight bearing here and progressing into linear. This is a challenge. So in an ideal world, you'd be seeing this athlete 3 to 5 times in that week, especially in these first 2 weeks. You want to make sure you're trying at least 3 times a week. 3 times a week here, so frequency is 3 times. 3 times. You could back off to twice if they're a very responsible athlete, but in an ideal world, you want to see them 3 times here, and then they're off to the game. So you're only really managing them for 3 weeks. So when you have an athlete with an ankle sprain or any type of scenario where you have a time-based goal, this is amazing. You just have to work backwards and just use this framework. Besides just thinking about your rehab exercises, whatever it's going to do to get them better, I think what you need to do is set the stage and let them see what that pathway looks like. So when they're ready to return to sport, they know all the criteria, that it's not just time-based, that it is criterion-based, subjective report, and that they have to be able to do all versions of plyometrics so that when they return to sport, they know at 90% they feel as strong as possible. This will help your clients, your patients, whoever it is that you're seeing as you progress them. And the minute that you do this one time, they will think that you are amazing. And this is very difficult to do, but when done properly and executed, and you have really good communication with the parents, you're unstoppable. This gives you a platform to be able to serve acute injuries, subacute, that are time-based. You just have to work backwards. I hope that helps.